Hello and welcome everybody. Today I'm very pleased to be joined by two experts in psychodermatology. And don't worry, we're going to explain what that is in a moment. But I'm very pleased to be hosting this along with the British Skin Foundation, who, as you all know, we work with very closely. And the last few weeks, we've asked people to put their questions in around this topic. But first of all, let me introduce you to our experts. We've got Dr. Rukshana Ali, who's a clinical psychologist, and Dr. Alia Ahmed, who is a clinical dermatologist. And both of them are, I was going to say eminent, but you're pretty high up in the hierarchy of psychodermatology. So welcome, both of you, and thank you for joining us.
Thank you.
So would you like to explain a little bit, I don't know, Roxana, is it best for you to explain, or Alia, what psychodermatology is, and then introduce yourself as well?
Go for it, Rukshana.
So psychodermatology is the link between the mind and the skin. Essentially, it's looking at how the skin can affect the mind and vice versa. And in psychodermatology, we tend to work in this sort of way, in this holistic fashion of thinking about not only just the skin condition, but also what's going on for a person psychologically. So as a clinical psychologist working in dermatology, this is really an interesting area for me because we get to see actually that those things that might appear outwardly, what's going on underneath and how psychology can help.
And I would just also add to what Rukshana is saying is that when I explain to patients what psychodermatology is, so as a dermatologist, I have an interest in psychodermatology and I've done a psychology degree in addition to my medical qualifications. And I always say to patients that it's the part of dermatology that deals with your mind and your skin together. So we're always looking at that relationship, how the skin is affecting the mind and vice versa, exactly what Rukshana said. And we tend to see people in two sort of groups. So we see patients who have got chronic, so long-term skin conditions that are affecting their quality of life and consequently affecting their mood, the way they interact with people, maybe causing them a lot of psychological distress. So these are conditions like eczema or acne or psoriasis. Those are the common things that we see. And we also see those patients who primarily have got more psychiatric symptoms, but it is presenting with their skin. So those patients who have appearance-related concerns, those patients who have got body-focused repetitive behaviors like skin picking or hair pulling. So we're seeing quite a diverse group of patients along a real spectrum of disorders, but the one commonality is that their skin is really impacting their quality of life.
So if you had an issue, would it be the dermatologist who would refer you on to the clinical psychologist, possibly?
It really depends on the unit that you work in. So, and this is a question that we are asked often. So, how do I actually access psychodermatology? So, if we look at the system that we're working in, which is the NHS, your GP can refer you directly to psychodermatology services because there are some services like ours at the Royal London who can see patients from any area. So, you can be referred directly from your GP. Your referral can come from a psychologist if you're already seeing a psychologist about how you're feeling and if you mention to them that you also have a skin condition and the two might be linked. And yes, general dermatologists can also refer to psychodermatology services. And then people have got different setups. So some dermatology departments, even if they don't have a psychodermatology clinic, may be lucky enough to have their own psychologist. So they may have a psychologist that they share, for example, with another medical specialty. So your general dermatologist can refer you to the psychologist that's attached to their department. In psychodermatology services, we often have our own in-house psychologists, like how Rukshana is in her unit. And then you can also, if you're in primary care, so you haven't got to secondary care yet, you can ask your GP to refer you to psychological therapies or talking therapies in the community. And probably Rukshana knows more about how to get that referral done.
So in terms of the primary care referrals, you can self-refer or ask your GP to refer you. But again, often what a lot of patients tell me is that they struggle to find somebody who understands the dermatology aspect. So that's where it might be helpful to ask your dermatologist as well. Do they know of somebody who can work with them in terms of the psychological or psychiatric aspects of their care, who has an understanding of the dermatology as well as the mental health.
Because it is, they do go hand in hand very much, don't they?
Yeah, we all enjoy working together, and because there's few of us, so it's very kind of you to say, eminent psychodermatology healthcare professionals, but actually there's few of us. There's not that many. So we all work together, and what we're trying to do is improve access to services, and we're trying new things. So we have, for example, for healthcare professionals, we do have a multidisciplinary team meeting. So if somebody who's a general dermatologist working in a different area sees a patient, thinks there's a psychodermatology aspect that they could get help with, they can discuss their patients with us. So we're trying to make sure that there's a way to access those services in one, through one means or another, whether it's the patient comes to see us or we advise their dermatologist or their psychologist. And it's all about us trying to have this cohesive network of people who have similar interests, but we all want to work together to do the best for our patients.
And I think sometimes that message, and it's good that you do that message, because I think because of the issues within the NHS and the waiting lists, that people don't realise that you struggle with that as much as patients do in trying to see people. So should we kick off? I've only chosen 4 questions that were sent in by members, because we did have loads and loads, and some of them were, interesting enough, some of them were very similar, but I just wanted to take sort of 4 quite slightly different ones and how you would tackle it. I'll start off with the easiest one. I say easiest, but you'll understand what I mean a bit later. So the question is, do you think hypnosis is good for constant itching? I think that's a Rukshana one to start
Yes,
with, maybe.
that's all right. So for those who don't know, hypnotherapy is a type of therapy which focuses on deep relaxation. It has other uses as well. It can also help with pain management, as well as perhaps altering that relationship with uncomfortable bodily sensations. Um, in terms of hypnotherapy helping with itch, I actually wonder about this, because in the NHS, it's not something that's routinely offered. There aren't many hypnotherapists who work in the NHS, and even fewer, I think, who work in dermatology or psychodermatology services. But that's not to say actually it doesn't have a place, because lots of case studies have shown it's got an effectiveness when working with chronic itch, like pruritus or eczema. So it does actually work, and it seems to be helpful for those people in those case studies, but there aren't those large scale research that we might see where it might then end up a nice approved treatment, like, for example, cognitive behavioral therapy or habit reversal, which have had a lot of research put towards them. I suppose my other reticence with hypnotherapy is not everyone actually gets good results. About 20% of people struggle either to be um, what's called susceptible or able to take on board hypnosis. And that also might be because their hypnotherapist hasn't got the right skill level to be dealing with the issues that they're presenting with. So I think this goes back to our earlier comment about, actually, even though somebody might be very skilled in mental health or in managing pain and relaxation, because they haven't got an understanding of dermatology and the skin condition, that's where it might fall apart. So again, it's about finding that hypnotherapist that has the right skill level to work with a skin condition. But also, I don't know if Alia has any thoughts on this, but I would also wonder about whether other aspects of the itch had been sort of considered or ruled out. And I don't know, Alia, if you've got any thoughts about this question.
Yeah, so I mean, if we look at the question another way, it's also asking about what are the maybe alternative treatments or interventions that are available for itch. And yes, so the first thing to do is to find out what is causing the itch. Is it an inflammatory skin condition that you can see or you can feel on the skin? Is it an itch that is coming? So some people have got, they feel itchy all the time, but there's no evidence of a skin condition. So you can have normal looking skin or normal for you looking skin, but you feel incredibly itchy. So actually working out where the pathology is, where the problem is obviously key. And especially when you're trying to treat a condition in psychodermatology, we try a little bit of everything, you know, so we're using our medical treatments, we're using our psychological interventions, we're combining everything together. We're talking about lifestyle, we're talking about sleep, we're talking about relationships and other, you know, significant psychological impacts to try and solve those issues. And I think actually, as Rukshana already mentioned, there is good evidence for some psychological interventions. And if we're talking about itch that's related to eczema, for example, there is really good evidence for habit reversal therapy. And that is a psychological intervention. So you're training yourself to, rather than scratch your skin, damage it further and to keep entering this itch scratch cycle, you're training yourself to perform a new behavior, a different behavior that is not skin damaging. And that has shown to have good results. So I think if we look at the question as, are there other interventions available for itch? Yes, there are. It probably depends, the success of them probably depends a lot on what the cause of the itch is. And we must never forget to also assess that part as well.
And I suppose that was that sort of what you're suggesting is like changing, is it the neuro pathways? So rather than just doing this where you would automatically go, you're training yourself to do something else.
Absolutely. So that's the premise of habit reversal. It's about having a competing response to that urge to scratch in response to an itch. So definitely it's about creating, like you said, those new neural pathways and developing a new way of coping.
Right, next one. The next one, as you probably know, is a very hot topic. It's about topical, there wasn't meant to be a pun there, in topical steroids. Now, we've done quite a few interviews with consultants, etc., about steroids and the issues that it causes. And we know that we've got an audience that, you know, do have some real problems with it. And I do know it's controversial, but I think it's very important to address it. So the question is, having found my skin is very damaged by topical steroids and now healing and withdrawal is very prolonged, I really struggle now to trust anything any doctor says. When you're gaslit and told drugs are safe, have no apology and no support through a very difficult condition, it has left me feeling lost, betrayed and angry. As still no research has been done and more people have been prescribed without warnings. So I think their concern is that you can obviously see there's a lot of things that that person is carrying with them, the physical issues of it. And we do know that withdrawal seems to be significantly harder than it was just to put the cream on to start with and a longer period of time. So actually, Rukshana, do you want to start with that that would be an Alia? I'm not sure which one would start on that one.
So I could give you a little bit of the background, maybe more of the sort of dermatology or the sort of science side of things. So it's a really important question. And for the person who gave that question, I'm sorry that they had to go through such a difficult journey. And unfortunately, for people like Rukshana and myself, we do hear this story quite often. And topical steroid withdrawal syndrome is a real problem. But again, as the question alludes to, there isn't enough research. We don't have enough information. And there is a petition going on at the moment from the TSWS community looking at trying to raise more funds and making this really a research priority. And we support that as dermatologists, psychodermatologists, psychologists working in this area. We definitely support that. Now, just a very briefly, topical steroid withdrawal syndrome, TSWS, this is actually a condition where people have used very high potency steroids on their skin for a prolonged period of time, and they develop a reaction. So they start to have rash in areas outside of where the original rash was, and the symptoms are very different from their original diagnosis, which is usually eczema. So this is usually experienced by people who have eczema because they are usually prescribed topical steroids. And the symptoms are, you know, intense inflammation of the skin, burning, and different feeling to the actual eczema. And there are different theories as to why this happens. Some people naturally may have very thin skin and the steroid skin thinned it further. Also, people may be developing an allergic reaction to steroids. It's very difficult to pinpoint one cause or one factor that made this happen to that person. So a lot of what we see and hear as well is understandable concerns about using topical steroids. So people don't want to use them on their skin, A, because they may be having the symptoms that I've just mentioned, or because they're worried about developing TSWS. So that's another whole area that we have to think about. There are treatments available, and again, we have to go back a little bit to the medicine here, because we need to work out why the patient was given the steroid in the first place, what steroid was used, how long they used it for, what was the original skin problem, is there anything we can do to help that? So can we replenish your skin barrier with moisturizers? Are there alternative medical treatments that are not steroids that are suitable for those patients? And they do exist. Are there non-invasive treatments? So things like phototherapy, if you have a history of eczema and then you develop topical steroid withdrawal syndrome, you still may be a candidate for phototherapy, so a light-based treatment to help your skin and the underlying inflammation. But these are conversations that we have to have in a holistic way. Again, so when I'm seeing a patient that has suffered from this type of condition, we will discuss the medical background, but we will also spend an equal amount of time discussing other important areas. How are you sleeping? What are your relationships like? What are you eating? You know, are there any factors that you think trigger your skin more than others? What impact is this having on your quality of life? You know, are you able to work? Have you been able to achieve the things you wanted to achieve? And then factoring in with our psychology colleagues, all the other psychological interventions that can help. Simple things like habit reversal, although it doesn't have to be simple for everyone, but also the more intensive, maybe talking therapies that can help to draw out some of the other psychological consequences of having those conditions.
Yeah, Rukshana, would you like to add something to that?
Absolutely. I was going to say, definitely, in terms of working with patients who are struggling with this, it's about working in a joined up fashion as well, and also working alongside the patient too. So I'm very mindful of listening to the patient's concerns, like Alia said, actually acknowledging them and acknowledging the anger that they're having, but then at the same time working from a psychological framework around helping them to build self-compassion and understand actually that this might have happened then, but the future could be very different, and thinking about some of those unhelpful beliefs that they might be having. So a therapy like cognitive behavioral therapy again might be very helpful, where we're looking at those thoughts and beliefs around what's happened and those feelings, and then working to unpick them in order to get to a more balanced view. So then actually the patient's able to move forward and engage in different treatment options.
And
Yeah, and if they don't want to have, you know, a medical treatment, I think actually this is where the psychology is so important, because a lot of the patients that I see that have these symptoms will talk about the trauma that they've gone through because of their skin and what's happened to them, and then unfortunate experiences where they feel like they've not been believed. And what I would say to those people is that actually the talking therapies or the interaction with the psychologist here can be really helpful to go back and try and work out how those experiences have shaped their thought processes. And yes, if they are willing to discuss other options, and it doesn't always have to be a medical treatment, it can be lifestyle based, you know, it can be looking at diet, looking at sleep patterns, looking at how they can improve their social sort of interactions with people. And also, as dermatologists, psychologists, people working in psychodermatology, we're also still learning about this condition, about TSW. So bear with us as well. And again, we're sorry that some people feel that they haven't been listened to, and I can understand why that's happened. If you are still in that situation, I would strongly encourage those people to ask to be referred to a psychodermatology service, because we can holistically support you. And it doesn't mean that we're here trying to convince you to try things that you may or may not have tried before. It's more about supporting you and your journey with your skin.
And I think for people who haven't seen people with this, it is quite shocking, and you can understand how psychologically damaging it can be. And especially is because, you know, you seem to be getting better and then suddenly it regresses, and that must be the really hard bit. You think, I haven't done anything different, and it's regressed, it's flared up again, it's really bad. And that's when I would say that you really need the support from somebody like Rukshana to help you through that. Yes, it will get better, but it's an up and down journey.
Yeah, absolutely. It's not going to be that linear journey at all.
No, it is shocking. Right, next one. My husband has severe psoriasis and tries to manage his stress levels. Any tips to further help with this? Thanks. And we've done a little bit recently, and I've heard that it isn't necessarily, is it a fallacy that it's stress that makes psoriasis worse? Or is it true?
Alia, would you like to step
Yeah,
in? Because I was going to say it's
so
bi-directional. I don't know how you
yeah,
feel.
I think that's a good point. Yeah, bi-directional. But yes, I mean, there is very well documented research to say that stress and psoriasis are linked, and stress can trigger the initial episode. And then, yes, then we have this thing where you have a stressful episode, it triggers psoriasis, then you have a long-term skin condition which is itchy, uncomfortable, painful, visible, and you're trying to manage that, and it's impacting your quality of life, and you're getting more stressed. And this is where, again, that vicious cycle, bi-directional stress and psoriasis, so stress triggering psoriasis, and then psoriasis further sort of triggering your stress response. But there is a good scientific background to it. And we also know that people who have got psoriasis, who have had a stressful experience, their sort of stress levels also stay quite high, even quite long after the stressful experience. So again, maybe that's a coping thing, but definitely there is a link between the two.
Definitely. And going on from that, we know that people living with psoriasis tend to be a lot more dysregulated. So in terms of managing different stresses and strains throughout their lives, it's much harder for them. In terms of answering this question, I think there's lots of ways in which this person's husband could manage their stress levels. So certainly the first thing that comes to mind is mindfulness, and this has got a really good evidence base with eczema and psoriasis in terms of just helping regulate the body and just feeling calmer. So the idea of mindfulness is being present in the here and now. And it doesn't mean you have to do long-winded meditations. I tell patients you could even go for a mindful walk and just notice what it feels like to be out and about walking. What's the weather like? What can you hear? What does it feel? What does the ground feel like under your feet? Are you walking on muddy grass, or are you walking on a pavement? Just paying attention to those things. So really being present, and even like making a mindful cup of tea. So paying attention to putting the tea bag in your cup and then boiling the kettle and noticing that feeling of the heat coming up the kettle as you pour it into the cup. So again, just paying attention. And these are skills you can gradually build into everyday aspects of your life. So it doesn't have to be a major thing. But if you do want to do more structured mindfulness, there are lots of really good apps that are available that you can download. Structured mindfulness sort of exercises that are about 20 minutes long. So again, some people find them very helpful before sleep. And again, I would say the basics are really key as well about self-care. So making sure you're eating well, you're sleeping at the right time, you're taking care to engage in those self-care activities, looking after yourself. Because I know, again, when you're living with a long-term skin condition, sometimes those things can go out the window, and you can just think, right, I'll do that another time, or, it won't matter if I just stay up a few more hours. But actually, it all has an effect on your stress levels overall. And other things as well, if possible, exercise is a really good idea for managing stress. And just, again, increasing those endorphins in the body. But again, I appreciate if there's a psoriasis flare, it might be tricky. So thinking about what is manageable in that moment.
And I think that we could all do with a bit of mindfulness, because nowadays you just see, you're watching telly, but at the same time, you might be scrolling through Instagram or something because you're getting that instant buzz.
Yeah.
So you're doing two things and you're not actually looking at either one particularly. You just don't give your brain a break, do you?
No.
So
And that's where it's really important to start learning those skills in order to just, I suppose, preempt any stresses or strains again that might be coming, because life can be stressful, but also flares can also come out the blue too. So if you're able to mitigate as much stress as you can by building in mindfulness or other activities into your daily routine, it almost helps buffer any additional stress that might come along.
yeah. Right. And our last question, which you're going to have to help me in how we pronounce this word. I was diagnosed with psychoderma,
Pyoderma gangrenosum.
right, pyoderma in November 2019. I have seen various dermatologists at different hospitals and nothing is working. I'm physically drained. I can't sleep due to pain. I can't lose weight because I can't exercise due to the PG. Actually, that's a good word, PG, being on my lower left leg. My mental health is at all-time low. The PG went into remission last year, but has started up again. I currently have no fat on my calf and the muscle protrudes out of my leg. I'm at my wit's end with it, and hospitals have now given me amputation as an option, but I don't want to lose it. I am unable to have any immunosuppressants due to having sepsis 3 times, but surely there must be something else I can have. Any health advice greatly received. Please help. And you feel this poor person's, I don't want to, pain, but pain at so many different levels coming at her.
So pyoderma gangrenosum, or PG, is a skin condition. It's a dermatological condition, and it's referring to developing painful ulcers on the skin. And they can happen for no reason at all. Sometimes people have got other autoimmune conditions like inflammatory bowel disease or rheumatoid arthritis. And it is a very difficult problem to manage because you have to manage what you can see on the skin, you have to manage the pain. If the patient has got other conditions, then you need to start medications. You need to see if those medications are going to work together. So everything that this person is telling us about their experience, unfortunately, is not uncommon with PG patients. They often do really, really struggle, and they're struggling with several things. So this is a very, a very clear example of psychodermatology where it can be most helpful, because you've got your physical symptoms and then you're having the psychological outcomes of having those physical symptoms and the impact on your quality of life. Now, what I would say from a dermatology point of view to the patient or the person that has asked this question is, obviously you should engage with the dermatology team that are looking after you to see what options you have. It sounds like they are doing that. But also these issues around pain, around how they're feeling, around lack of sleep, around difficulties to exercise, actually voicing those as well. Because sometimes as a dermatologist, for those people who are very used to using the NHS, that things are very time limited. So they spend a lot of the consultation talking about the physical symptoms, what somebody can see, oh, this is weeping, or this looks red, or this dressing is not working for me. And then your time is up. So you didn't have a chance to say, actually, the pain is stopping me from sleeping. Actually, I'd like to exercise and I'm gaining loads of weight. Actually, this is affecting my relationship. So I think some practical tips are to write those things down and actually mention in your consultation, I have written some things down that I'd like to discuss with you, or saying, if we haven't got time, I would like this to take priority next time, and asking and saying, I feel like I need help with some other impact, with the other impacts that this is having. Is there anyone else that I can speak to as well? So is there a pain specialist that they can be referred to? Is there talking therapies available or a psychologist available that's attached to the department? Are there any sort of nurse education programs? Can their patient be seen a little bit more regularly for dressings and things like that? Because, and now, the way that the pressures are in the NHS system, if you don't ask, you don't get. So I do think, and some people find it really difficult to ask, and I understand why, because they think we're really pressured, we don't have enough time, we wish we had more time. But if you also help us by having these sort of things ready for us to say, well, actually, okay, so they've told me X, Y, and Z in addition to everything else, how am I going to handle this? So I think that is also something practical that people can do for themselves. And again, I do always say the fallback is do ask to be referred to a service that can manage your mental health at the same time as managing your skin. I don't know if Rukshana, you can suggest anything else in addition.
I was also going to suggest, because it sounds, going back to an earlier comment you made earlier, this person's been through a lot of trauma as well, and I think we see that a lot in psychodermatology. Often there's been a horrendous time with the skin or the skin condition, and then actually that's also affected the mental health. So again, I would be thinking about, if I was seeing this person, making sure we're checking out, how they feel about their trauma, and do they need a specific trauma intervention like eye movement desensitization and reprocessing, that's EMDR or something like that, just to help them again feel in a better place, able to cope with perhaps the discussions around the potential future treatments or plans around this condition.
And if patients are able to be referred to their local talking therapies, or they have managed to get access to that psychology support, I do always offer as well that do let them know that you're seeing a dermatologist. Do share our name, secretary's details, because we are always happy to talk to the psychologist, and the people that I've reached out to or they've reached out to me, even if we don't work together in the same setting every day, it's been really helpful to be able to for each other to understand what's happening on their side. So from my side, to explain to a psychologist, well, this is what this skin condition is. It's painful, it's itchy, it can go everywhere, it can have an unpredicted flare. That knowledge from our psychology colleagues is actually really helpful, so they know what they're dealing with as well. And hopefully, Rukshana, you agree with that.
Absolutely. Yeah. And like you said, it's really helpful just to have that joined up care as well.
And I think from the patient perspective, and I always say to people before they go to a doctor's, is for God's sake, which is what you've just said, write everything down. A, because you forget yourself, but there is limited time and you can't wait for the consultant to ask you the question that you want to answer, because you don't know what question or what the burning problem is when you see somebody. And as you said, it's much easier if they can tell it to you, because you can then go bang, 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 hopefully, and just say, this is what you need to do, rather than they're sitting there waiting, saying, well, is she going to ask me if I'm okay, or something like that. And it's the little things, isn't it, that I think can make a difference.
Yeah, I mean, we're getting better at asking questions. So we do when we do our courses and things, and Rukshana and I teach on the same courses often. You know, we are trying to train up our juniors to ask those questions more sensitively and spend a little bit of time assessing people's psychological health. But it is helpful for us if people will give us a little pointer in the right direction, or if you're not comfortable to discuss it, you can say, I've watched this video about the impact on mental health, and I think this might apply to me. Can we talk about it today? Or, you know, is there a better time that we can talk about it? Can I email? Can I send an email to your secretary to explain how I'm feeling? So there are lots of different ways. And we do appreciate that people don't always find it easy to bring those issues up, but we do want to know. And I would say we do want to help. And there's a lot more that we're trying to do in psychoderm research as well. So I think this is a growing field. And recently, the British Skin Foundation put out a themed sort of research call and have given a large amount of funding to a psychodermatology project. And hopefully, we'll be able to facilitate more psychodermatological care across the UK when we have more research to support us.
And I didn't mean that you don't ask questions. It's just like there's a million and one questions you could ask the patient, and you know, especially if it's slightly odd what the patient might want to say. And I think you're right, it's so difficult because you, as a patient, you're embarrassed to say something, whereas actually as consultants, you will have heard nearly everything anyway. And that's what you want to do, is help them, isn't it? You're there to help.
Yeah.
That's what you're there to do. Anyway, I think we're out of time now. And is there anything, I was going to actually ask, is there anything that we haven't sort of covered that you think that we should do? I know, Rukshana, we spoke about, you know, how to access services, but I think we actually covered that at the beginning. I don't know, is there anything, any other sort of pressing things that you feel that we should tell people to help them?
I think there's a lot of information available online, like Rukshana mentioned of some apps earlier. The national foundations for a lot of the common skin conditions do have really good websites. So there's the Psoriasis Association, there's the National Eczema Society, the Vitiligo Society, there's Alopecia, so Alopecia UK. So if you do have a skin condition, I think it's really worth trying to find out online who the supporting organization is, of course British Skin Foundation as well, to try and signpost you, because you can get a lot of information, and also about how to safeguard your well-being and your psychological health through those websites. And you can often find contacts to psychodermatology services through websites for your condition. So do your research. That's what I would say. And again, I don't like to put it all on the patients and making you do all the work, but actually you are your own best advocate. So I would say definitely research your own conditions, see what support's available, look at the British Skin Foundation website. You can look at the British Association of Dermatologists website. We do also have a section for well-being and psychological support on their skin support. So that way you can arm yourself with the right information.
And don't go down the influencer route.
Well,
No,
content
I,
creators can be helpful, you know, especially if they're talking about real skin and what their experience is. But yes, I think undue influence is sometimes not as helpful, and you need to balance. Not everybody's skin journey is the same. Two people with psoriasis, two people with eczema won't have the same journey, won't have the same, it won't look the same on them, it won't present the same on them. So we have to have that balance between the two. What do you say, Rukshana?
I was going to say as well, if you are going down that social media route, always go for reputable sources. So, you know, if it's a dermatologist working in an NHS setting that you know, follow them as opposed to somebody who's got, you know, 1 million followers, because they might not necessarily be giving you the best advice or the most accurate advice. So again, look for those reputable sources like the British Skin Foundation as well as others. Yeah.
And I would always say, and just watch out for where people slip in an ad. You know, to me, that's a red light going on there. So
Yes, you have to be aware, and that's with
Yeah.
anything on social media. You have to keep your wits about you, look at who the person is, what they're talking about, what their credentials are, what their own experience is. And you know, we're used to appraising people in medicine. You know, that's one thing that we're taught to do, but general public is not necessarily taught to do that. So definitely, yeah. And again, looking at your condition online or asking for information from reputable sources is probably the best way forward.
and
And
I noted that along everything that we said, you were saying evidence-based, and I think that's it. It's the
definitely.
evidence base we're looking for. So
I was just going to add as well, Catriona, if you don't mind, along with the reputable sources of dermatologists, it's important as well to make sure that the psychologists are HCPC registered, because unfortunately, psychologist isn't a registered term in the UK. So again, some people on social media might not have the adequate training and be putting out psychological advice, which isn't always appropriate. So yeah, sorry, that was another caveat I'd give.
Yeah, that's true, actually.
Yeah.
So you can check registration for doctors via the GMC website, and you can put in their name or you can put in their registration number if that's available on their you know, their social media account or their website. So you can check that they're qualified in dermatology to be able to give you that advice, and with psychology, as Rukshana said, looking at which body they're registered under and what advice they're qualified to give. It's important. Not everybody is a cowboy. But what we want to do is, if you're going to spend a lot of time listening to advice, we want you to listen to the advice that comes from the best source possible.
absolutely. And I think also with chronic conditions, people do get absolutely to their wits' end in hoping that there is going to be that miracle cure. And we know we don't necessarily like the word cure. So thank you both so much for your time. It was I found it really invaluable, and I'm sure lots of other people will do, because we covered some big areas there, but still with the same thing is it is about looking after getting the right medical advice alongside looking after your mental health all the way through, which is just as important. So thank you both very much.
Thank you.
Thank you.